Let's start with the facts. ADHD is the most common disorder in childhood. It affects between 1 to 2 children on average in every classroom in America. ADHD is just a fancy term or label for kids that have developmentally inappropriate levels of inattention, overactivity, and impulsivity. Importantly, because of these behaviors, children with ADHD experience dysfunction. They have difficulty managing their behavior in large group settings such as classrooms. They might disrupt their family unit, and they may have difficulty interacting appropriately with peers and the adults that they come into contact with on a day-to-day basis. Unfortunately, many children with ADHD do not get the help that they need. Some families get so wrapped up in the diagnostic process, they forget that the only purpose of a diagnosis is to help facilitate treatment. Further, many children with ADHD receive treatments or interventions that are not evidence-based, and we wouldn't expect them to move the needle in the direction that's going to help the child do better. Myths, misinformation, and opinion are often ruling the day, and this is at the expense of children really making true progress to help them succeed better in their classroom or their home. In this massive open online course called Everyday Strategies for Children with ADHD, we're going to focus first on the prevalence, nature, and causes of the disorder. Next, we're going to focus on how to best evaluate for the presence of ADHD. And we're not going to be admiring the problem. We're going to be talking about how you assess for ADHD with an eye towards treatment. How do you inform what you're going to be doing with treatment based on your initial assessment and evaluation of the child that you're working with? Finally, we're going to finish up with some practical everyday tools that parents and teachers could use to help the child be more successful both in the classroom setting and the home. This course should be helpful for educators, parents, professionals, and anyone else who works with children. Through participation in 4 brief modules, participants will walk away with evidence-informed knowledge on the best way to work with children with ADHD. In addition, an emphasis within the modules are practical skills that participants can take and use within daily life if they are working with youth with ADHD. We look forward to working with you in the course, Everyday Strategies for Children with ADHD.